I'm Dr. Meenakshi Jain. I'm a board-certified OBGYN practicing in St. Petersburg, Florida. I've been in solo practice in St. Pete since 1984. I'm also a mentor and a proctor to teach robotic surgery. I have an epicenter in St. Petersburg General Hospital for teaching robotics. It's one of 2 in Florida and one of 27 in the whole of United States. We have physicians from all over US come to learn robotics. The topic today I want to talk about is chronic pelvic pain in all ages in women who have negative tests, negative exams, or they have negative radiological testing, but they have negative CAT scans, they have negative ultrasounds. I've been in practice, like I said, for almost about 30 years in this area, and I've always had a passion for trying to treat women with chronic pelvic pain. Over the years, I have seen in my practice that on an average, at least 10 to 15 women a month I see who have had pelvic pain treated for many years and their symptoms have not gotten better. These women have also seen multiple physicians before who have done multiple testing on these women and they've found no pathology. These patients have been given pain medications, have been sent for pain management, sent to pain clinics, and basically have become dependent on pain medications. And then they were quoted to be drug addicts or drug dependent. As I was saying, many women suffer with chronic pelvic pain. It is not difficult to make a diagnosis of the etiology or the reason what is wrong with them if there was an abnormal test. If they had an abnormal CAT scan showing a fibroid tumor, showing an ovarian cyst, showing a pelvic mass, any bowel problems, renal pathology, then making a diagnosis and treating them is usually not difficult and they respond very well. The challenge comes when these women have these pains and they have seen a gastroenterologist, they have seen a urologist, they have seen an internist, and they have seen a gynecologist, and they have had CAT scans, ultrasounds, and all the testing done. However, the tests keep coming negative, and at that time, the patients are basically being told, all your tests are negative, it's in your head, and there is nothing can be done. In my experience, what I have found that most of these women have either endometriosis or interstitial cystitis, IBS, and these conditions can happen starting at a very young age. So the chronic pelvic pain has a continuum which starts when these women start having menstruation, continues to have similar symptoms even when they get into their perimenopausal years before they go through menopause, and then afterwards when they are even postmenopausal and older, and they will have the same history and symptoms. Over the years, I've realized that taking a thorough history and a thorough exam is the most helpful in making the diagnosis of any medical condition, specifically with endometriosis and interstitial cystitis. Endometriosis starts out at a very young age. So when these women come in with pelvic pain to my office, many of them have had very severe painful periods starting at the age of 14 or 15. A lot of time endometriosis runs in the family, so these women have been told over the years, don't worry about pelvic pain or crampy periods because that's just part of life. Many times these women are not going to even complain about pelvic pain for a long time till it becomes very severe. I'm not talking about mild dysmenorrhea where they have mild cramping and they would respond to low-dose birth control pills or to pain medication like Motrin or Advil or any one of similar medications. However, when these girls have symptoms of severe cramping where they are not going to school or they are missing school or missing activities, there is time for us to concentrate and try to find out if they indeed have endometriosis. They also, in addition to their crampy periods, will complain of severe backache, bloatedness, mid-cycle pain, and many times painful intercourse. Most of the time, their examination is extremely tender. However, when the ultrasound is ordered, almost invariably their ultrasound is going to be negative. As these women get in their 20s and 30s, they will complain in general of continued crampy periods, but their periods start getting heavier. They may also have ovarian cysts. They may also have complaints of abnormal bleeding. Many of them will have infertility, and many of them would have other symptoms of bowel endometriosis like cramping or painful bowel movements. Again, most of the time, their ultrasounds and their CAT scans are negative. They have seen multiple physicians and basically have been told that this is the way it is. Take your birth control pills and just take your pain medication. The next stage, when many of these women who have not been diagnosed, is when they come to in their 40s or when they get in the perimenopausal age. At that time, they are starting now to develop endometriosis of the uterus, which makes their periods extremely heavy, clotty, and very uncomfortable. At that time, they usually are complaining of having severe dyspareunia, which is painful intercourse, and they are also complaining of frequency of urination, enlarged uterus, bloatedness, and other symptomatology. In the past, when these women were done having childbearing, the treatment which was offered was a hysterectomy, or they had to live with this. Many times, when they are in their 30s and 40s and are done childbearing, they have had partial hysterectomies. The biggest challenge is managing women who are postmenopausal, who are in their 60s, 70s, and 80s, who have had pelvic pain almost all their life, who have had symptoms which are very suggestive of endometriosis all their life, but have never been diagnosed. But they continue to have this pelvic pain. By the time they come and see me, they usually have already seen a gastroenterologist and probably have had a colonoscopy. They have seen a urologist. They probably have already had a CAT scan and an ultrasound, and invariably, most of them have had a negative report. Their CAT scans are negative, their ultrasounds are negative. The most important thing I have found in these women is when I do an examination, they have very tender enlarged uterus and very tender ovaries. These women also have other associated symptoms like bloatedness and gassiness and low back pain. They can complain of pressure on their bowels. They can also complain of urinary frequency and urgency. They complain of painful intercourse. All these symptoms are telling me that there is a higher probability of them having endometriosis of the uterus or adenomyosis, or may also have scarring from prior endometriosis which they have had all their lives. Unfortunately, many of these women have been told by many other physicians or their peers that endometriosis disappears after menopause. The truth is that the endometriosis and the consequences may continue for many, many years after menopause. They may have scarring from prior endometriosis, adhesions, and these findings are not picked up on a CAT scan or an ultrasound. Only way to diagnose the pathology is by doing a laparoscopy. It is important to mention at this time that endometriosis has been associated with a much higher incidence of ovarian cancer. As we know, in women, ovarian cancer is one of the hardest cancer to diagnose because their symptoms are very nonspecific. We also know that ovarian cancer can have precancerous condition for 10 to 15 years where all their tests are negative. But once the women are diagnosed with ovarian cancer, when we ask them in hindsight, most of them have been complaining of non-specific lower abdominal discomfort, bloatedness, gassiness, and very tender exam. And then when we take their history, they do mention that they used to have very painful, heavy, crampy periods all their life or other symptoms suggestive of endometriosis. In my practice of 30 years, I have always been passionately involved in trying to take care of these women with chronic pelvic pain, especially when they are in postmenopausal age and who have not been diagnosed to have any other etiology of pelvic pain except a tender pelvic exam. I believe all these women with pelvic pain and who have negative tests should be investigated further by doing a diagnostic laparoscopy. Robotic laparoscopy is the best way to diagnose and treat their pathology, in my opinion. Very young women, 16, 17, 18, who have been treated by traditional method of birth control pills and medication, who are still suffering with pain, have been found to have pretty severe endometriosis. A recent article in Adolescent Gynecology mentions the need for us to diagnose endometriosis at an early age to prevent the future consequences and suffering of these women. The same thing applies in the perimenopausal women and also postmenopausal women. Over the years, by following this algorithm of doing laparoscopy in women with chronic pelvic pain and negative testing, I have found that many of them have adenomyosis, endometriosis. They may have adhesions from prior endometriosis, prior surgeries, from diverticulitis. They may have precancerous disease. They may have also early malignancy. And all these things will not be picked up by any one of the traditional testing like CAT scans and ultrasounds. Even MRI may not be able to pick up many of these pathologies. In view of these findings, I strongly recommend that all these women with chronic pelvic pain should have a robotic laparoscopy or a diagnostic laparoscopy to check for a pathology. Most of the time, the treatment can be done right then, depending whether or not they want to maintain childbearing and at what age are they. And therefore, by robotic laparoscopy, if needed, they can have a hysterectomy done at the same time as an outpatient procedure. If they are younger and want to maintain childbearing, with the robot, we can do excision of endometriosis, we can do uterosacral ablation, and by doing these managements as an outpatient procedure, we have been able to relieve pain in most of these women. There is another condition called IC, which is many times associated with chronic pelvic pain. A lot of women with endometriosis have associated IC because it's an autoimmune disorder. Endometriosis, IC, migraines, fibromyalgia, IBS, all these conditions go hand in hand. So many of my patients who have had chronic pelvic pain, when they also complain of urinary frequency, urgency, hesitancy, superficial dyspareunia, entry dyspareunia, feeling of incomplete emptying, and when on my examination, I find that they have very tender bladder, I do investigate for IC, and many times that is the etiology. We have many different treatments, diet, physiotherapy, exercises associated with IC, but one of the treatments which I have found has almost treated 100% of my patients with IC is called a neurostimulator. It's an InterStim implant, and I will be giving another presentation on InterStim. Thank you for watching my video. If you have any questions about chronic pelvic pain, robotic surgery, IC, or InterStim implant, you can leave a message on my page on Kaigi, or you can contact me and we can have a video consultation. Thank you.